Bismillahirrahmanirrahim. A 29-year-old woman come to the emergency department due to fever, chills, and lower abdominal pain. 2 days ago, the patient underwent dilation and curtage for a 9-week missed abortion. After the procedure, she initially had light spotting, but the bleeding has become increasingly heavy and malodorous within the past few hours. She also developed increasing abdominal pain and a fever unrelieved by acetaminophen. The patient has no chronic medical condition and has had no surgeries. Temperature is 39 and blood pressure is 88/50. Pulse is 118 per minute. On speculum examination, the cervix is visibly 1 centimeter dilated and has prurulent discharge at the cervical os. The uterus is enlarged and has cervical motion tenderness. Transvaginal ultrasound show a thick endometrial stripe. Urine pregnancy test is positive. The patient is started on broad spectrum antibiotic and undergoes suction dilation and sharp curtage. The patient is at increased risk for which of the following condition. So this patient is 29-year-old woman. She came to the emergency department due to fever, chills, and lower abdominal pain. The patient underwent dilation and curtage for a 9-week missed abortion. Her temperature is 39 and blood pressure is 88/50 mm of Hg. The uterus is enlarged and has cervical motion tenderness. So the patient is started on broad spectrum antibiotic and undergo a suction dilation and sharp curtage. Based on these hence, what is the diagnosis of this question? The diagnosis of this question is septic abortion. And for the septic abortion, we have to remove the product of conception. So the product of conception can be removed by the suction dilation and sharp curtage. And this patient is increased risk for Sherman syndrome, which is adhesion between the endometrium. So here the correct option is choice A, development of intrauterine synecdoche. Why the choice A is the correct one? Because this patient fever, lower abdominal pain, and prurulent cervical discharge after dilation and curtage for a missed abortion are due to septic abortion, a polymicrobial intrauterine infection. The treatment of septic abortion is broad spectrum antibiotic and a suction dilation with sharp curtage, which remove the infected retained product of conception. During this process, the endometrial basilar's layer denudes and causes inflamed, obliterated uterine cavity prone to intrauterine synecdoche development, which is adhesion, known as a Sherman syndrome. Come to the incorrect one. Dysplastic changes to cervical epithelium. So dysplastic changes to cervical epithelium which result in cervical intraepithelial neoplasia or cancer, which occur due to human papilloma virus infection. Choice C, implantation of ectopic endometrial gland. So endometriosis is not associated with intrauterine surgery or infection. Infarction of the pituitary gland, which is also called Sheehan syndrome. So Sheehan syndrome, infarction of the pituitary gland, can occur due to obstetric blood loss, for example, postpartum hemorrhage. Choice E, malignant transformation of trophoblastic tissue. So gestation trophoblastic disease, which is the malignant transformation of trophoblastic tissue, typically occur after a hydatidform mole pregnancy.